The term zombie drug describes a specific physical phenomenon, a substance that causes rapid, aggressive flesh decay in living tissue. This substance began as a 1962 German medical project. Researchers originally developed the compound to control blood pressure and manipulate circulation. 10 years later, the FDA determined the drug was too powerful for humans. It was restricted to veterinary hospitals, specifically for use as a sedative for massive livestock like cattle and horses. For 39 years, the drug remained within that agricultural system. It safely sedated large animals without leaking into the human population. The mystery is how a substance intended for the veterinary supply chain escaped that environment and entered the street market. The chemical mechanism designed to slow the massive circulatory system of a 2-ton animal acts with destructive force when introduced to human biology. In 2001, the drug made its first documented appearance in the human street supply in Puerto Rico. Underground chemists began mixing this veterinary sedative into heroin and cocaine. They used the drug's heavy tranquilizing properties to extend the duration of the narcotic's effects. Inside a human user, the drug causes severe vascular issues. It rapidly constricts blood vessels, creating a blockade that prevents blood from flowing freely. As circulation drops, blood oxygen levels fall, starving skin tissue of the nutrients and oxygen it needs to survive. The resulting decay appears quickly. Severe tissue damage and rotting patches can emerge within 4 to 8 hours of ingestion. By adding a livestock medication to illicit narcotics, these chemists created a localized epidemic of skin necrosis. The modern epicenter of this crisis is the Kensington neighborhood in Philadelphia. Data from the area shows a rapid shift. In 2018, there were 100 documented cases of victims suffering from this specific chemical decay. By 2021, that number climbed to 3,468 victims. Local infrastructure is buckling. Addiction centers and hospitals in the area are often full, with many patients requiring daily wound care to manage their physical injuries. This situation has a devastating impact on local families, who must watch their loved ones experience physical deterioration in real time. Kensington's current struggle shows the result of a mutated chemical spreading through a population with few defenses. This crisis presents a double-edged challenge. Users are caught between the powerful chemical pull of addiction and the ongoing trauma of their physical wounds. Traditional recovery protocols are difficult to apply here. The urgent medical need to treat rotting tissue often complicates the standard detox process. Because the drug can cause permanent damage, regardless of a person's age or gender, avoiding all street narcotics is the only reliable way to prevent this outcome. Protecting the next generation requires focusing on the clinical reality of the drug's physical impact. Understanding the 40-year path from German labs to American streets provides the context needed to address this tragedy and prevent it from expanding.